Hello, I'm Christopher Stout. I'm a vascular surgeon at Ozark Regional Vein and Artery Center. Today we're going to talk about neuropathy and what it is and potential treatment options for our patients. Neuropathy is where the nerves are damaged, whether it be by diabetes, chemotherapy, or vascular disease with poor circulation, leads to this burning or numb or some painful feeling in the foot, and it may go partially up the leg. It's different than sciatica, where basically a pinched nerve in the back radiates down the foot, but this is originating in the foot from damaged nerves and leads to the pain or numbness or a burning sensation that these patients feel. Arteries can get bigger and they can get smaller, but they need to know when and how to do that. And it's the nerves that secrete chemicals and send electrical signals to the arteries that tell them to either get bigger or get smaller. When you have neuropathy or specifically diabetes, it can damage the nerves in addition to damaging the arteries, and your arteries don't dilate and get bigger. They don't constrict and get smaller like they're supposed to. And then you throw in the peripheral artery disease component of building up the plaques from cholesterol and everything else that block the arteries, and then that ends up leading to more problems with the nerves, and it's this endless circle of vicious pain, and your nerves are trying to tell your arteries something, your arteries are not responding, and the nerves are getting worse. As you get more and more blockages in your leg, the nerves, they can actually be damaged even more on top of what caused the neuropathy in the first place. Diagnosis of neuropathy is going to entail a full history and physical exam in the office by your physician. It may include making sure that you don't have bone spurs or some type of tumor on a nerve in the foot that could be causing very similar symptoms. Treatment's going to be divided into a few different categories, from least invasive to most invasive. First of all, the treatment's going to include a use of nerve blocking medicines. Neuroprolotherapy is where they inject certain substances around the nerves in the lower leg, and that will help some patients, but not all of them. And again, it's experimental, all the way to acupuncture to becoming even more invasive, which is something called nerve stimulators. Now you have central nerve stimulators, such as a spinal cord stimulator that can be placed in your lower back that helps block the signals or trick the body into thinking that no signals are coming from the foot, it's coming from this nerve stimulator in my spinal cord. What a peripheral nerve stimulator, or PNS, is, it's a stimulator that you insert percutaneously through a small skin nick in the lower leg around the ankle, and what it does is it tricks the nerve and artery locally so that the foot can't feel the pain, and that really alleviates the pain for a majority of patients, and it also avoids the complications of spinal cord manipulation. So if you have any questions, head to our website, and especially if you're local, fill out the screening quiz that we have on there, and that will allow us to determine if you're a good candidate for peripheral nerve stimulator or other procedures.